Hello, bonjour, Connect Hearing community. How is everybody doing? This is our 5th week together, and I can't believe it. It's been really quick. Time flies. I know we may not feel that way, but definitely time flies. Slowly we're learning how to work in this new way, at least for a while, and just trying to adapt to this new life, right? I'm usually a very positive person, and but I must say that I have had very odd and negative days throughout this pandemic situation, and it's been a roller coaster for everybody, but I try always to focus on what we can control, right? So I think it's something that helps us with keeping our anxiety down, is try to focus on what you can control, and what you can't control, we can't do anything, right? So let's keep it positive. On a positive note, I had received quite a few emails from patients that I had for a long time. I had a picture of Nina in my office for a long time, and they all knew about her, and they're like, how is Nina? Is still she around? And yes, so today I have my superstar, Nina. That's my little Nina. Say hi, Nina. So Nina is my old lady. She's 14 years old, and that's a positive thing from all this pandemic. I am enjoying spending the time with her. I don't know for how long she'll be here, so that's been good. Just wondering, do you have pets? Do you enjoy pets at all? And that's okay if you don't, but they do bring a lot of, she calms down my heart sometimes, so it feels good. So I see quite a few people join. Hi, Angela, that's my coworker. Hey. So today, here we go for our 5th week together. We had 4 other videos already posted on our Facebook page. So if you have any questions about cleaning, Bluetooth connectivity, batteries, check them out. And if you haven't met me before, I'm Christiane Basilio. I am an audiologist. I have a doctorate degree in audiology, and I have been working for Connect Hearing for 13 years. We had received a lot of requests when I'm doing my lives to have a closed caption put on, but unfortunately on the Facebook Live, that's not possible. So the closed caption is added afterwards, and then you should be able to that will help you there, and we totally understand, right, why you need closed caption. But on a side note, I need to apologize. Perhaps from my first or second video, I was actually quite nervous to be here. It was something new to me, so I stumbled my words quite a bit. So I was reading the closed caption from those videos like, oh my god, how those people will understand my my words. So hopefully that wasn't too bad for you. So I see a lot of people are joining us. Hello, hi. So we're going to be talking today about tinnitus, okay? Tinnitus, we know that is a very sensitive subject. And I'm here today to explain a little bit what is tinnitus, what can cause tinnitus, different ways you can manage tinnitus, when to look for help for tinnitus. Before I go over that, I want to mention that like any other health symptom that we have, we need to be very careful where we look for information on the websites, because, as I said, being a very debilitating symptom, you might believe in some false promises out there. Okay, so I don't want to be the bad guy here, but unfortunately tinnitus has no cure. However, there is a lot of different ways we can learn in how to manage your reaction to tinnitus. Okay, there are a lot of questions about how do we pronounce the word tinnitus or tinnitus. The most common way definitely is tinnitus, and that's how we're going to be saying it today, but it's not wrong to say tinnitus as well. Okay, so a lot of things that I'm going to be talking today as well is based on what Richard Tyler. He's a PhD clinical audiologist from the University of Iowa, and he was one of my professors from when I was doing my doctorate degree, and he has done an amazing work with our tinnitus patients. We will be creating a FAQ document on our website on tinnitus, where we're going to list quite a few websites that I trust, and you can take a look, and if you want to know more in depth about tinnitus. Okay, are we good? Let me see. Hi Fred. Oh, Nova Scotia. Hey, hi Rick. Hello. And Murney Maxwell had mentioned in my picture, he said that is a very annoying sound, right? So yes, tinnitus can become a very annoying sound, and I hope I can give you some light at the end of the tunnel today for you to help you to manage your tinnitus. So you may not know that 37% of Canadians have experienced tinnitus, okay? It's quite a common symptom. And tinnitus is a sound that you perceive without any other external sound around you, okay? So a lot of times when we ask patients in the office, do you have a tinnitus? And I believe it's a word that a lot of people already know what it is, but a lot of people only associate tinnitus to ringing and buzzing in the ears. And the reality is that you can have way other different type of sounds that still considered tinnitus. So tinnitus, you can be perceived as a ringing and buzzing, quite common. You can perceive as a hissing, a wishing noise. There is the music ear, so it sounds like a music. And the challenge is, you can even hear 2-3 different sounds at the same time, or alternate sounds. So basically, anytime you're hearing a sound there's no other external sound, we will probably consider as tinnitus, okay? The tinnitus can also be perceived in one ear, in both ears, in the middle of the head, outside of the head. So it's all, it can be constant, it can be intermittent, it can be perceived as pulsatile. So you see the variety of sounds that you can actually perceive in your ears, in your head. It can be tinnitus, okay? What is the most common reason that you can have, cause that you can have tinnitus? It's aging hearing loss, related hearing loss, and noise-induced hearing loss. So in short, if you lost your hearing, your brain start missing some information. So in our inner ear, we have some hair cells that are vibrating when the sound is going through. And if that vibration, if the hair cells are not functioning anymore, the brain start missing some information. And the brain could just create that tinnitus sound to fill out those gaps, okay? So this is a very, let's say, easy way to explain. Of course, there's many theories out there why you perceive that sound. And the challenge is there is other underlying causes as well that could cause tinnitus. So it could be diabetes, it could be high blood pressure, it could be excessive wax in your ears, it can be some middle ear issues, and it can be sudden hearing loss. Some medications. So some medications, they can be ototoxic. So if you Google some medications that could cause tinnitus, I will definitely watch that. Of course, sometimes there are type of medications that you need to take it for other reasons. But we just need to be aware if you start taking any medication and suddenly you start noticing tinnitus, right? So I would watch that. Most of people, I'm sure, as I mentioned, 37% of Canadians have had tinnitus at some point. I'm sure all of us have had some type of a noise in our ears. So I think the most common noise in the ears is when suddenly you have like this beep and it goes away, and then you feel kind of a muffled sound in your ears. don't really recognize that as tinnitus, because tinnitus we expect to last at least 5 minutes, like 3, 4, 5 minutes in your ears. If it's just for a couple of seconds, it's more what they call as a idiopathic transient sound in your ears, but that's a quite common thing to happen. If you are exposed to a loud sound, so let's say in the old days and even nowadays, we love the concerts, and there is something about of listening music in a loud volume, right? It just, I don't know, it just touches you more. So it's, people like that a lot of the time. And then after this big concert, or after you've been exposed to these loud noises, you will hear that that buzzing, ringing sound, usually from those type of exposure, and it goes away. Then month later, you do the same thing. So if you do that over and over, and same idea if you're working noise environment, right? So you have a long day at work and it's super loud, and you're not wearing any hearing protection, and you start noticing this ringing over and over, that tells you something, okay? Because from that ringing that you start noticing more often, that could easily be related to some loss of the hair cells in the ears. So we need to be careful. We need to use the hearing protections, right? So there are some hearing protections you can buy online, or we do custom-made hearing protection that if you were going to be exposed yourself a lot in noise, we need to protect our ears, okay? And unfortunately, when we're younger, we don't really give much attention to that. I do feel nowadays people are a little more aware. I think we have been doing a better job in bringing awareness for hearing tests and hearing care, but still, you know, there's lots work to do on that field, okay? So just be careful how your body is reacting to that loud sound. Okay, so when should we look for help? Okay, so you might be noticing that ringing, and that's becoming a bit more constant for you. I would say anytime you start noticing ringing, and as I said, if it's not just that quick seconds sound that you notice, but that is lasting for a few minutes, is happening once, twice a week, I would definitely look for an assessment, okay? It's important to know if that's just, you know, maybe there is, we need to find out the root of that ringing, and for you to also not worry that you maybe have a disease or something, okay? So what is really involved to the reaction of tinnitus is that worry, right? It's a very annoying sound, like Myrnie said on the comments. So it's eventually that really gets you, okay, for some people. So when should we look for help? One thing for sure I would like you to keep in mind: if you wake up one day and you just notice the ringing one side only, okay, you maybe feel a little change in your balance as well, but I'm looking for, I'm just focusing now, it's one side, unilateral tinnitus, I would look for help as soon as possible, okay? That's something we don't expect very much to have just in one side, so yeah, we need definitely to have a full assessment as soon as possible. If you're experiencing the tinnitus in both ears, and perhaps you know that you were, let's say, worked in with heavy equipment for a long time, you know you're exposed to loud sounds, we still should definitely look for help, but I don't want you to be super, let's say, stressed, okay? But look for help, okay? So most of the assessment for tinnitus is a multidisciplinary assessment, okay? So first we should see the physician, that he will rule out any other type of probably any other health issue, maybe the diabetes, the high blood pressure, all those symptoms, all those causes that I mentioned to you in the beginning. And then he probably will send you to an ear, nose, and throat specialist, and to an audiologist, a hearing instrument practitioner, okay? So we first need to know, okay, what's causing that, that tinnitus. And once that the assessment is done, then we can create a personalized treatment, okay? So one thing that happens a lot is, I don't know if you have heard this word, and I hope I can say that word correctly in English, but is habituation, okay? So a lot of people have tinnitus for a long time, and maybe when that all started, they were, let's say, just had a baby, life is busy, they're working noise, so they really don't really pay attention on that ringing, the buzzing in the ears. And they just get used to that. And it's quite interesting. We get some patients in the office to do a hearing test, and we ask them, do you have tinnitus? And they say, no, I don't have any ringing in my ears. And then when they go in the booth, sound booth, where it's super quiet, they feel that ringing in the ears. They can hear a sound that it's not the sound that I'm providing to them. So that means they habituate to the tinnitus, and some people even believe that everybody can hear sounds in their ears because they have that for so long. So this will definitely be our goal, right? When we're trying to help and find ways to manage tinnitus for most of people, but it's not always possible. So if we do any treatment, therapy, sound therapy, and if you habituate to tinnitus, that's amazing. But if you don't feel bad, because that's something that not everybody can do. But we want to try to teach you how to not overreact to tinnitus. Okay, so that's kind of our goal, and for you to feel that you are in control of the tinnitus. Okay, like Richard Tyler says a lot, and I like this way he mentioned is tinnitus is a sound. It's not bad or a good sound. It's a sound. The problem is your reaction to that symptom, and the habituation is when our brain don't have any emotion reaction to something. Okay, so that's the main goal when you go for a tinnitus treatment. So okay, so let's say you went through all the assessments. Are we doing good? I know we have talked. We have some questions there, so I'll be answering those questions at the end. So we went through all the assessment. You definitely most likely need the hearing test as well, and there's other questionnaires. There's quite a few steps that we need to go through the testing. And now we know, let's say, maybe why you have tinnitus. Okay, if it's something that cannot be fixed, maybe chirurgically, medically, and you don't have a hearing loss, for example, the main part of the treatment will help you is to work with some sound generators. So we call them as maskers, and there's a lot of different types out there, and technology is here to help us. So there's a lot of apps on the phones you can have, and it's about creating another more, let's say, a comfortable, something that gives you pleasure to hear too and relax you. Okay, so it might be nature sound, this might be like a classic music, anything that can distract your brain to not paying attention on your tinnitus. Okay, so remember, that's what we want to do. We need to train our brain to focus on something else. Okay, so definitely avoid not being a very quiet environment, because that will be more pronounced, that sound in your head, right? And then on top of that, with the sound generator for these patients without a hearing loss, and there's other causes that couldn't, be fixed, let's say, we do a lot of the counseling part. Okay, so we usually work on the 4 primary areas that would be thoughts, emotion, sleep, and concentration. So tinnitus can affect all of them, or maybe one of them. So we are going to go through some questionnaires and try to find what's been causing the most stress for you, what is affecting more your quality of life, and that's what we're going to focus on. Okay, if you went through all the assessment and hearing loss is the end result, and that's most likely the reason that you have a hearing loss, because remember I said, I don't know, I can't remember now exactly what is the percentage, but maybe 95% of cases that you have tinnitus, you have like a high frequency loss. Then we're going to add on top of perhaps the sound generator, you may still need it, the therapy, the counseling on the primary areas, and the hearing aids. Okay, so the hearing aids, what the hearing aid can do for you for your tinnitus. Again, we're thinking about that masking, that situation where your brain is distracted from your tinnitus, okay? And a lot of times you may don't perceive your hearing loss, because remember, hearing loss is a very gradual change, so your brain adapt to that. But the tinnitus usually comes more abrupt, is a big change, and is an annoying sound, right? So most patients, sometimes when they come to us, they are not very worried about their hearing loss. All they want is to get rid of the tinnitus, okay? But we need to think about that the tinnitus is a symptom. So we gotta find out the cause. And if the cause most likely is the hearing loss, we need to treat the hearing loss, okay? And the hearing aid is basically, if your hearing loss is not related to any medical condition in the middle ear that could have surgery to fix it, hearing aids is the way to go. Okay, so once you start stimulating your brain with that missing sounds, a lot of the times the brain will calm down and maybe not pay attention as much on the tinnitus. Important to say that change, it does not happen right away. Okay, it's not that you're gonna put a hearing aid today, that in a week from now your tinnitus is gone. No, and the reality is sometimes it's not gonna go away ever. Okay, but your brain will work with that sound, and you are going to start feeling that sound is not as important anymore. It's kind of your brain, that state of mind that I was talking about, okay? That anxiety that sometimes people get depressed about it, you will help you to tune it out from that sound. And understanding what can really happen, okay? Not creating false expectations that you're going to put a sound generator or a hearing aid and that's going to go right away. That will help you also to keep your anxiety level low. And stress is definitely something that can spike your tinnitus, right? So now with this COVID-19, we're home in a quiet setting, stress. I wouldn't be surprised if a lot of people that have tinnitus have been noticing more their tinnitus, because you were in a quiet setting. There is, you're going to be more aware of that sound. You're more stressed, and maybe your routine has changed. So it's important to perhaps, it may be, the positive things that I mentioned to you about the pandemic and the situation we're home now, it maybe is a good time for you to maybe track, and you may be able to know what triggers it, that spike of tinnitus. We can't say for sure that too much caffeine causes more tinnitus, or too much alcohol, or too much sugar, because we're all different, right? Our body reacts differently. So, but yes, if you try to track, sometimes you maybe be able to notice, oh, if I drink like 2 cups of coffee in the morning, I definitely felt my tinnitus was worse at the end of the day. So you can try to kind of focus and pay attention on that a little bit, if the tinnitus is really bothersome to you, okay? So that treatment I was mentioning to you, it's very much related to that. If you do have the hearing aids, and they have apps, as I mentioned, they're called Tinnitus Balance App, and there's way other different type of apps that you can download to help you. The hearing aids will help you to mask that noise, and the counseling, okay? So if you, for example, got your hearing aids and you're using sound generator, and the tinnitus is still a big issue for you, we need to do more about it, right? And knowing, yes, there is no cure, but there's quite a good ways that we can retrain our brain to not focus as much on that sound, okay? It's interesting. I have my dad, he has tinnitus, he has hearing loss. He worked with heavy equipment for a long time. So I saw all the phases, the changes that tinnitus in his life. So I remember because before, when he was working, he never really mentioned much about tinnitus. And then suddenly when he retired, he was he wants to find a cure. He was going to every single doctor. He wants to try medication. And even though I am an audiologist, and Doesn't matter. You can tell your family, your friends, but sometimes they don't want to listen to you. I explained to him that, and he wants a cure, and I mentioned to him like there is no drugs really for tinnitus, right? There are drugs that can help some side effects of tinnitus, like anxiety, depression, and then of course your hearing professional would suggest you maybe see a psychiatrist. You may need that treatment for a while to calm down and help you with the whole process of treating your tinnitus. But there's not a real medication that can treat tinnitus, okay? Not that I know of that has a proof, okay? And then once there was the same idea as I mentioned when he would start wearing hearing aids, was not about his hearing loss. He always kept saying, no, I hear fine. No, I just want to do something for my tinnitus. And slowly he definitely felt that improves. He tells me that he still notices his tinnitus, but it's not as intrusive as before because the hearing aid helps him to tune it out and focus on something else. So yeah, so I hope I have brought, let's see if I think I went through everything. Yeah, I think I did went through everything. I hope you were enjoying the talk. We know there's some questions there. Let me see if I can, let's see, can MS be cause of tinnitus? I don't think MS is on the list, the cause of tinnitus. Maybe medication that cause tinnitus. I won't be saying yes or no here, but definitely I haven't read MS causing tinnitus, okay? It could be a side effect of a certain medication that you may need to take. And that was from Crystal. Other question we have, Bruno. So he asked a question. I understand Phonak has an option that can reduce the tinnitus sound. How effective is this option? So what Phonak has is they have what it calls a tinnitus masker. So it's a white noise sound that we can create a special program on the hearing aid. So it's all about having your brain distracted from that sound, right? So what I have seen more in my practice, Bruno, if you have a hearing loss, most of people just with the amplification of the hearing aids, they already notice a bit of a relief from the tinnitus, okay? At nighttime, maybe when you take it out, you maybe will notice again, but eventually that will calm down. And as long as you also help yourself to keep your stress level low, your anxiety low, okay? And I know it's easy sometimes for us to say when we don't suffer from it, but it's the reality, okay? And that phase, as I mentioned to you, what my dad went through, it's quite common, okay? You get to the point that you relax about it and you habituate, as I said, or you learn to not stress as much about it. But it is effective, but it's all about as a very individualized, personalized, let's say, treatment. When we do all the hearing tests and we measure level of tinnitus, frequency of tinnitus, and we'll see if you need or not. And is it step by step? Is trial and error? Okay, because it's hard to know how our body reacts to things, right? And then we'll definitely find what would be the best treatment. But it can be effective. Yes, Bruno, it can. That a question I don't know. That's from Rick. Rick. If it's Rick Mostad, yes, it's from him. Rick, any advice on ancient Navajo remedies for tinnitus? Nothing that I know of, Rick. Nothing that has a real proof, a scientific proof. Okay, I would say the managing stress, managing your reaction to tinnitus, and of course with the help of professional if you need, and hearing aids and sound maskers are still the best protocol for tinnitus treatment. And okay, I think we go through the questions. I will keep watching if there's any other question that comes up. I hope you enjoy the talk. We will be posting those websites on the FAQ document in our website. I think you will enjoy that. There's a lot of information more in depth, and hopefully that you learned something from me today. Thank you for the hearts again. Thank you for watching the video, and I hope you're enjoying them as much as I'm enjoying. I hope you're enjoying them as much as I'm enjoying doing them. We are here for you. Stay safe, stay connected, and big hug for everybody. Have a good week. Bye.